I guess we're live. I'm looking at this. Still new to me.
The stream is live.
Yep. There you go. What up, Coy?
What up, man? Coy got a t-shirt on this time.
I get loose. I'll get more loose. Get more loose.
What? Happy early birthday to you.
Thank you, sir. Thank you, sir. Thank you, sir. When is y'all's? Y'all's coming up too?
Yeah, just flip your numbers.
For real?
Yep.
Oh God.
Yep. Just flip your numbers. That's us.
This is the flipping numbers.
Yep.
What's going on, peeps? Oh man.
Sorry, man. Don't judge me, y'all.
What up, Wally? What up, Walt?
On camera too.
You see that, right?
Part L.
Right.
Right.
What up, Erica? How are you?
Whose man's is this?
I was just thinking about. I'm like, man, we all got a birthday coming up. Oh my goodness, we're knocking on the door to 50. Ain't that crazy?
Hey, cut that out.
Hey, what up, Spivey?
Cut that out. I'm not there yet. I'm fighting, man. I'm fighting.
Hey, CC. Wait, think about it. We were in high school together, chilling in class, and now we're older.
Old. Me and Coy competing for the most gray hair on the chin.
Well, I would have it, but I had Jarrell over the weekend, so I ain't got nothing on my face. Look like a baby face.
Now, yeah, you look kind of high schoolish.
The students big on me. I went to school today. They're like, "Oh, you must have had drill because you look like a baby face." Like, keep playing. That'd be an F for your class too. Keep playing with me. I got y'all.
Yeah. Awesome.
We got about 4 people joining, so we're gonna start in a few more minutes. Just give it a few more minutes. Just chop it up with everybody.
Yeah.
Thank you, CC. Yeah, I'm not used to this. I gotta have at least a goatee or something. This yeah. I look too young for this one.
It's okay. You can rock it.
Nah, I can't do this. I can't do this.
He can't.
Oh man. Oh man, our last live was actually a good live. Last live we talked about thyroid, and that was actually good when we hit a lot of good information. And even the one before that, we talked about what did we talk about? Weight loss, nutrition, working out.
Hold on. I got one for you, Coy. So we're talking about what's that? The powder stuff you put in your drinks.
Yes, the electrolytes.
Liquid IV. Give me your opinion.
Liquid IV, I'm more of a fan of LMNT, Redmond, and just regular pink Himalayan salt.
I can't drink salt water.
Yeah, it does wonders, especially for me, because I have a problem with getting enough water as is. And
okay.
So if I don't have those electrolyte, infusions, and let me look, because I looked at Liquid IV, and that was a reason why it turned me off. Let me look at the
I like it. It's overpriced, but I like it.
Yeah. Let me find it. It was something that as far as the ingredients, let me look.
I'll look for you. Let me see.
Oh, you got it right there?
Yeah.
Hey, Walt, say what about Celtic salt?
Yeah. Celtic salt is okay.
I ain't never heard that. Oh, Celtic. What is it? I ain't never heard that.
Yeah, that's fine too. Okay, so here's the thing with Liquid IV, is the pure cane sugar.
Yeah, that's what I'm saying. The primary ingredient.
Yeah, so that is what turned me off with it. Like, if you look at LMNT, if you say it really fast, it's element. It's really magnesium, potassium, sodium.
That's all you need.
Yeah, and that's really all you need. So that's why I like it. So like with Liquid IV, they'll put sugar. They got citric acids, dextrose, actually cane sugar and dextrose. That's 2 sugars right there.
Yeah. Oh
So
yeah. High sugar content.
yeah, so that's where I more of trying to keep your glucose levels down, and on top of that, they also have stevia in it. So it's already going to try to ramp up your glucose levels and insulin surges just to get you that high of that energy boost, but you're going to crash.
What up, Jason? What up? What up?
Yeah, I got it pulled up right here.
Yeah.
And see, my thing is I drink about at least 1 to almost 2 gallons of water a day.
Yeah. Yeah.
So I'm just flush. That's why I got to always put something in there because I'm flushing my system.
Of course. Of course. I mean, you got to stay hydrated, and it adds a little bit of taste to it. Oh, it's Dr. Quest static.
No, that's Derek.
Oh, that's you?
Yeah, Derek got a little feedback.
Oh, okay. Cool.
Oh,
All right, so Erica says she's been doing apple cider vinegar with the Himalayan salt and water. Feel amazing. So explain apple cider vinegar. I hear it all the time, and I don't understand it. Like I'll use it for my chicken to wash the chicken, but how does that help?
Well, I mean, the benefits of the apple cider vinegar, it helps you with glucose, insulin. It helps you with digestion as well. And so there are many benefits to it. So it just depends on the person and what you're really using it for. When you look at apple cider vinegar, there's so many things that go along with it. But it's made of fermented apples, right? And so whenever you have some type of fermentation, like that's why I like kimchi, or I like sauerkraut. Those are fermented foods that give you some good bacteria. And so it helps you, with digestion or breaking down of foods. And so that's one of the main benefits of it. A lot of people use it to help reduce fat and weight loss and things of that nature. I don't know too much about that, to be honest. But I know more so for people that are having issues with cholesterol, blood pressure, which we're going to be talking a little bit about that with heart health today. But again, I think for me, the biggest benefit is the antimicrobial properties because of the fermentation. So you're getting some probiotics with it as well. So it's really good to do that.
Okay, so how much? I mean, I know this is all off topic right now, but I mean, Erica brought up a good point. So when it comes at, because I see it all the time on Instagram or TikTok.
Yeah.
Is it something you can take every day, and if you can take it every day, how much of it can you really?
Yeah, I mean, 2 tablespoons of it. A lot of people do it at nighttime or when they first wake up as soon as they wake up on an empty stomach before they eat, or they do it at night after they've fasted after their last meal. So it really helps on those fronts. But just 2. You don't need to like go with that old bottle, but just like 2 tablespoons is enough.
Okay. I was just wondering. It was interesting. I'm skeptical about that. Like, should I even try that?
Yeah.
She says she does a cup full and a gallon of water, so I drink it. Okay.
Yeah, I mean, it's gonna add a little different taste to your water. Yeah, but it has some probiotics in there.
Okay.
Sorry, I'm trying to fix my feedback. Is it better or still the same?
It's a little better, but I don't know if you have any like headphones.
Oh, shoot, I tried. It didn't work.
Oh, there we go. Now I got you on the earpiece.
Hey, there you go.
Yeah, that's why you a doc.
Yeah, I wouldn't have got through high school if it weren't for you guys.
You keep saying that. I don't know about that. All right, let me pull this thing up so everybody.
Thank you, sir.
I done closed my thing. Let me pull mine up. Let's see.
All right, so I know some of y'all are not able to see this, but it's just a simple outline of actually what we're going to be breaking down today when it comes to it. Going to be segment one. So if y'all can see it, I'm sorry, let me see if I can zoom in some more, see if you can even see it. Almost. Let me see, zoom in some more. 200. So you can see this part here. So segment one, understanding heart disease. So we're talking about understanding heart disease, common heart disease, hypertension, heart attack, stroke, risk factors when it comes to your different risk factors, genetics, lifestyle, diet, key heart disease statistics. We break it down. Yeah, they fight and sleep. So segment two, nutrition for a healthy heart, and break it down and stuff when it comes to that part. Segment three, physical activity. Segment four, stress management, which is definitely a good thing. Segment five, warning signs. So we're going to actually break all of this down for you all. I got to see if we can hit up Carbon Q, because she does have an actual PDF or a link, just like the last live, where y'all can click on that and you actually have it. So I'm going to hit her up real quick and make sure that it's available. And something you all can do to follow along. We like this because it helps keep us on an outline. We don't want to keep you longer than an hour as it is. Cool. At any time as we're going over this, ask your questions. Please ask your questions. We love questions, and that's what we do. We just chop it up. So please ask your questions. We just want to make sure we hit everything. Anything that we miss or you may have a question about, like I said before, ask it. Hey, Homestead Rachel, how are you? So with that said, let's start it off. So we're talking about, so we know February is Healthy Heart Month. Is that what it is? I forgot what it is.
Heart health.
Heart health. Thank you. So February is Heart Health Month. So that's what we're hitting up today. The biggest thing we want to look at is hypertension, heart attack, and stroke. Those are the three biggest things, especially with our diet, especially those that are in the South. We're heavy on the salt. We were talking about that previously. So we're heavy on the salt. So we're looking at hypertension. Can you all just break down hypertension? I'll pull up a PowerPoint on it real quick. Can you all just break down hypertension? What exactly does it mean?
Well, let's start from the beginning, because a lot of people think, and I like to put it out there, when you think about hypertension, first of all, it's not your heart that's controlling your blood pressure, it's actually your kidneys. So I like to let people know that. They think it's actually it's my heart that's controlling it, it's your kidneys. What it is that your kidneys are working on different receptors, and so certain blood pressure medicines work on those receptors to get the kidneys to relax, to squeeze, different things of that nature. So it's actually your kidneys that's controlling your blood pressure. So I let people know that off tops. But if you think about hypertension, it's just your blood pressure, and it's your blood pressure to appropriate range. They have the new date myself. I think it's the JNC9, I believe it is now. It's either the 8 or the 9. I got to look that one up to be positive, where it talks about the different ranges for blood pressure. So now your stage 1 blood pressure is your 120/80. It used to be that normal range, but now if it's considered 120/80, that's stage 1, letting you know that there's something possibly concerned about your blood pressure. But then when your blood pressure starts going up, the 130s, 140s, 150s, 160s. So we also talk about the systolic and the diastolic. The top number, which is usually your larger number, is your systolic. That is how well that your heart goes when it squeezes. The bottom number is your diastolic number. That is how well your heart relaxes. So you get that lubbed up, that squeeze, relax. So your systolic, the top number is the squeeze, the bottom number, the relaxing part of the heart. The bottom number is then the relaxing part of the heart. So you got that squeeze, relax. The thing is that you just want to really monitor your blood pressure. It's called a silent killer because nobody really feels it. Nobody thinks about it. Not you, but people will typically say, well, I might have a slight headache. I might be a little tired. I might be a little dizzy. And yeah, that's fine. But is it related to your blood pressure? Is it related to the stress that's going on in your life? And so that's the things we have to take in consideration. The other thing is that people really don't check their blood pressure because they think everything is fine. They always think, oh, no news is good news, so I'm not checking my blood pressure, which is not what you want. You want your blood pressure to actually be in a good range and stay about equal in a lower or normal range, but staying equal, not that up, down, because the up, down, your pressure goes skyrocket, then it goes down, then it goes back up. It actually puts stress on the heart or on the vessels, especially in the brain and the heart. So think about the muscles being like a rubber band. The rubber band, you'll stretch it, but so much. But when you stretch it over time, it will stretch and it will not relax anymore. That's the vessels in the body. The vessels will stretch, relax, relax. But when they stretch to a point, they won't relax. So increased pressure will then cause a rupture. So you can either have a heart attack, you can have a stroke. And usually I'm more concerned about the stroke aspect more than the heart attack. What you got, Coy?
Man, I mean, you know, when we're looking at heart health, of course, you know, the first thing that folks think about is blood pressure, hypertension. We see those categories there from healthy, elevated, stage 1, stage 2, and etc. And for me, you know, the blood pressure is a gauge. It's almost like the temperature gauge in your home. And I even compare it even with like blood sugar. We were talking a while back about diabetes and those things, but they just give you an account of how balanced the body is. As Dr. Whiteside was talking about, you know, that when we look at the top number, you know, that's the amount of pressure when your heart's beating. So think about like your pipes in your house. Like when you turn on your faucet, the water rushes through the pipes and there's pressure there. And then if you turn it off, you know, there's another pressure there. That's the bottom number. So the top number is when you turn on or when the heart's beating, you know, that's that top number, that's systolic. And then the bottom number is the amount of arterial wall pressure that the blood is flowing through those arterial walls when your heart is not beating. And the key with blood pressure is that, just like you said, it can be a silent killer when it's elevated. But there are numerous reasons why a person will have issues with hypertension. And the research really looks at, you know, like the South. You alluded to this a little bit earlier, Eric, is that, you know, down in the South, you know, our lifestyle is a little different. And what we see is that there's a higher prevalence of hypertension. And, you know, what that does is it leads us to quickly go to morbidity and mortality because of your risk of that. So it's very important to make sure that we look at these issues with your blood pressure. You can't ignore it because it can lead to premature death.
Yep. And like you were saying before, that pressure. So you take a look at the screen, and that's what he's talking about. That systolic, the number when the heart contracts, diastolic when the heart actually rests. And what Dr. Coy was talking about is that pressure. So that pressure on that wall. And I tell people you can think of it let's say how do we say this? Think of it as a straw, similar to that of a straw, or as a water hose. And you're trying to push more water through, but it's such a narrow passage. After a while, that inside line is just going to wear out and it's going to rupture. And that's the same thing when it comes to those vessels. After a while, it's just too much pressure. It's just going to rupture. So that's what we have to think about. One thing Erica was talking about here, which is interesting here. She says, my blood pressure, the systolic is okay, but that diastolic is high. So you think about it, when the heart is relaxing, you still have a high pressure during a relaxation phase. What could she possibly do to help bring that down? Because you remember we were talking about earlier, as she was talking about earlier, she's doing the apple cider vinegar because she's doing the exercise. So Erica, you do look good. So keep up the good work. So what else can she do to help lower that bottom number?
I'll let you take it, Coy.
Yeah. So I think when we look at blood pressure and hypertension, I think and this is something that actually came across my desk today in regard to a patient that has hypertension, and he was having blood clotting, extreme blood clotting, and didn't know what was going on with it. And so, you know, looking back at it, like when we look at the research shows that hypertension can come through multiple ways. Number one, research shows that inflammation is it's associated with hypertension, but they don't know how it's caused. That's what the traditional medical model looks at this from. And so for me, as a functional medicine practitioner, I'm always looking at the why. Why is this happening? You know, what is the root cause of this? And so inflammation is at the top of the list. And when we look at inflammation, inflammation is an immune system response. It is our primary immune system's call to action in our own internal military system to deploy out to protect us against multiple things. The next phase of it is that, about 90% of people that have hypertension have what we call primary hypertension. And then the other 10% is like secondary hypertension. These are things that happen with issues pertaining to renal, renal impairment, stress, sympathetic nervous system overload, and numerous other causes that contribute to it, right? And so when we look at those numbers, we have to look at, okay, inflammation. Okay, well, we got to look at also the blood vessels that supply that blood. It's a highway, and it's miles and miles, hundreds of thousands of miles of blood vessels in our body. We're beautifully, masterfully made, and it's amazing that we're alive and have all that blood going through our system, right? And so, one of the other things is that, well, if the roadway or the vessels are impaired, just like we have a highway on like down here in South Florida, I-95, it seems like it never is going to get fixed. It's always it's always getting torn up, rebuilt, but it never gets done. It's always being fixed. And so what does that cause? It's going to cause a lot of traffic. It's going to cause a lot of, stress and everything of that nature. And so just think of that roadway, a bunch of potholes, a bunch of detours and traffic jams. Same things. That's what we call epithelial dysfunction. That roadway is going to cause issues with blood pressure, amongst other things. Another one is, issues even with, I was preparing this, but, oxidative stress. That's another one. Mm-hmm. Basically, the cells of the body, there's a bunch of stress on those cells that they're not able to, we eat food, mash it with oxygen, digest it, get glucose into the cells to be used for energy. And when that is impaired, that's where we see issues with diabetes, hyperinsulinemia, too much insulin. These are factors that pertain to high blood pressure as well. And we just talked a little bit about this earlier, is when the kidneys are damaged. The number one reason why individuals have blood pressure issues and pertaining to renal failure is because of diabetes. And when we have all the stress going on around our bodies, sympathetic nervous system, that's our flight or fright, right? So when we have that going on, that's also going to cause issues with blood pressure. So this is all, it's a myriad of different things. So I'm going around the question a little bit because I want us to kind of take a step back and look at this from, from a root cause standpoint. It's not just looking at just one number and saying, well, this number is good, and then let me reduce this number. They all go together. So when we're looking at like your diastolic number being so high, that again, that's the amount of pressure on the arterial walls when your heart's not beating. Mm-hmm. That's not a good thing to have. That's like saying you got a whole bunch of pressure in your pipes of your house, and it shouldn't be there. So that's something that you have to look at pertaining to your overall health. And we'll get into it a little bit later on, is okay, well, how do we test for these things, and how do we really understand where the problems are?
Yeah, if y'all take a look at the diagram here, this is what the doctors were talking about when referring to hypertension. Again, when I break it down to people that I teach, you have to break down the terms. The prefix hyper means high. I tell people, think of it as a kid that's just on a lot of sugar. They're constantly running around this very high. So it's a lot of pressure, or a lot's going on. And the tension is just that force. So it's a high tension in that vessel. That's where that comes from. And this affects the whole body. If you take a look top left corner, depression, anxiety, that's what we're talking about, mental health. Going underneath that, going from left to right, which is backwards for me, heart disease, sexual problems, going over to the right side, stroke. So again, you can stroke out, head bleed, or what we call TIA or CVA, something of that nature, head bleed. And like Dr. Coy was saying, when that bottom number, that diastolic is so high like that, when the body's supposed to be, or the heart's supposed to be relaxing, that definitely is an indication I won't say you, Erica, but as general, when that number is high like that, especially when we have 911 calls, we get on scene, I get a guy, his pressure is maybe 220 over 138 or 180. I'm like, yo, that bottom numbers, both numbers are way too high. That bottom number, I don't like it. And a lot of times they, well, I don't have hypertension. I'm like, obviously you do. You're about to stroke out. I'm having visual problems. That's because there's so much pressure on those vessels behind the eye that after a while it's just going to rupture. So we have to lower that. We have to lower that pressure. One thing we give, not suggesting this to anybody, one thing we give, we may give. How did I forget it that fast? Oh, I can't think. What's the name of it? What's the name of the medication we give for chest pressure for ischemia?
Nitro.
Nitro. Thank you. I forgot that fast. We give nitro just to bring it down to help relieve that that pressure. That's one thing. So you have the stroke, you have loss of vision, kidney problem, what they were talking about earlier, and bone loss. What we're talking about is osteoporosis, weakening of the bone. So these are the things that you have to be concerned with. These are the things that the older we get, we were joking about that earlier, that we're getting closer to.
No, you're getting closer to it. I'm not.
Well, I'm getting closer. I ain't got no gray hair, so I ain't got no hair. But we're getting closer to half a century. So we have to actually monitor this a little more. Homestead was talking about, does exercise help? So when you think about it, does exercise help bring this pressure down? So either one of y'all take that.
No, I'll let you run with it, Coy, because I'm always coming from more of a Western view. And definitely the Western view does not do what I like, is more at the cellular level, and I like to hear you break it down on the cellular level.
Yeah. So again, I think when you look at those root issues, again, we're talking about, with hypertension, inflammation, right? Inflammation is primarily associated with that, and inflammation can be everywhere, right? So when I'm looking at a case with an individual that says, hey, I need to get better with my hypertension, again, I'm looking at their whole body, looking at signs of root issues, why that person may be inflamed. And so for me, a lot of times exercise, people think that exercise should be the primary go-to. And I say, a lot of times that may be the wrong thing. Maybe sometimes that actually can be the worst thing that a person can do. That exercise, if we look at this like a pyramid, right? We have a pyramid and there are levels to that pyramid. And we look at, say, hypertension or obesity or, things of that nature that we want to improve our health. A lot of times people put the exercise at the bottom of the list at the primary foundation, that they just focus. Like, that's why we get in January, we go straight to the gym. Let's go clean up, let's pump a bunch of weights or get on the treadmill. And sometimes when a person is really inflamed, it's actually going to cause more stress. It's going to cause more inflammation. And it's also going to lead them to more discomfort and more dysfunction. And so I look at the opposite. So when you're talking about what about diet, yes, you need to look at the environment. You need to look at your environmental factors, triggers that are addressing that. So yeah, the number one thing, you got to clean up your diet, right? Clean up your diet, find out, or substitute some inflammatory foods, find out what foods that may be triggers for you. Like a lot of times what I do is I test patients for food sensitivities, allergies, and things of that nature, something that may be that may cause more inflammation, to be able to get them to be able to have proper nourishment and proper absorption of their nutrients. And then we look at even environmental toxins. We talked a little bit about this last time with a patient that I had with thyroid. There was heavy metals. There's so many chemicals and environmental toxins, mold, and all those are one of the things that we also have to look at in regard to hypertension, because this is going to cause inflammation. And as you get better, or as you continue to address those triggers and address those things, and you remove those culprits out of your lifestyle, lots of people start to normalize their blood sugar and blood pressure. So we start seeing improvements. And then if they're able to start to get more active and don't feel like they have to, spend a whole bunch of time in the gym and have joints and, body aching, you're going to be able to start healing yourself. And that's going to allow your body to relax and have a better state of healing. So exercise is not always the best and number one thing to do for some folks. I think it's best, like we have that disclaimer, at the bottom there, you have to consult with your physician, get checked. Like when you're seeing blood pressure numbers being elevated, take some responsibility, look at what things that you need to do, substitute some things, but also get thoroughly checked by your doctor to make sure there's nothing else going underlying that can catch up to you.
Right. And the other thing is, there was a question earlier about anemia and does it affect blood pressure? Yes, anemia can negatively impact the blood pressure or impact the body because there's a lack of blood flow or lack of oxygen that's going to the body, which then stimulates an inflammatory response, which then puts stresses on the vessels in the body.
That's right.
And then invertly, I'm going blank on how to say the word, but it causes your pressure to go up instead of thinking it would go down. So that will definitely be an issue. Exercise is great, but I don't recommend, like Dr. Coy say, starting exercise at January. It was January 1, I'm going straight out because I've seen it. And I don't understand people go straight to wanting to start running. You haven't ran in 9, 10, 15 months. Well, all of a sudden you want to get out and start running. I don't recommend that. The first thing I recommend is actually seeing your doc, get a workup, making sure you're healthy enough to start exercising. Right. Because the one thing you don't want to do is go from sedentary lifestyle to now an extremely stressful, impactful lifestyle, which who knows, you might have blockages in some vessels. You start your exercise, it causes vessels to rupture or even causes plaque to rupture, which then leads to a heart attack or a stroke. Yeah. So we say definitely get checked out first before you start exercising. Now, I don't have a problem with it, and I don't think anything's wrong with it if you go out there and start walking. Walking's great, it's low impact, and you're starting to build up some stress to the body, but it's positive stress. So that's what you want, which is a good thing. So you can go walking, light exercising such as lifting weights, but walking and just seeing your physician first before you do any type of aerobic workout is what I do recommend.
Yeah, I mean, I let me jump on that because, I think folks will say, well, exercise, it helps. We get so much inputs about exercise. And like you said, there are different levels to that. And everyone is different. Everyone has wear and tear. Everyone has different health histories. Everyone has certain issues that they have going on. So much like say your favorite player on your team gets traded or is picked up, in the draft. Big thing that they do is they do a physical. They're investing a whole lot of resources and money into that person just to make sure that person is able to be able to perform. We have to take up that same
mentality.
We have to take that on. It's not just for our elite athletes, but we have to take that type of ownership of our health. And just like you said, it may be just starting out low impact. It's a sedentary lifestyle is not where you want to be, but you don't want to be, all right, let me go from 0 to 100. You haven't worked out in a while, and then you're all of a sudden trying to do a CrossFit competition in a month. Sometimes we have to pump our brakes a little bit and start slow and build up from there. But I think having a coach, having a doctor that is in line with helping you move through that continuum is so important.
One thing I noticed, Eric was talking about, said my my vision just started being blurry. One thing you want to do is, if you have a history of high blood pressure, I tell people, have a monitor at home where you can just take your blood pressure periodically. I recommend, this is just me personally, I recommend doing it the same time every day if you do it. So pick certain times to do it. That way you'll have a track record and you can see if there's any changes. Because if your vision is starting to get blurry, you need to figure out, is that because your blood pressure is up? And if your blood pressure up, is it systolic or is it diastolic? So we want to be concerned with that part. So we definitely want to make sure you keep track of, even when we go on calls, get there, you say, hey, I have a history of blood pressure. One guy in particular, he literally gave me a list like, this, my blood pressure, this is when it changed. I'm like, oh, wow, this makes sense. It makes it a lot easier for me. Then I'm giving my report to the doctor, ER doc, and say, hey, this is going on. These are the changes right here. And it's a lot easier to come up with a better game plan to help treat this guy for his high blood pressure. So that's definitely a good thing. She did say I did my blood work and everything was okay, but my weight still needs to come down. I'm supposed to be between 110 and 115 because of my height, but I want to stop at 135. So if we talked about that earlier, based on the numbers, these numbers, they're skewed and they're old numbers. That's one thing we talk about that in particular. For me in the military, I'm 6'1" and I weigh anywhere on a good day, anywhere from 215 to 230, depending, 215 to 220, depending. And based on my height, they want me to be at 180. I haven't weighed 180 since I was 21, 22, somewhere around there. Will I get back that weight? No, I won't. But I understand what they're saying. They want you to get down, but also look to see what's a healthy weight for you. Yeah, they say 110 to 115. But if 135 is a healthy weight and you're losing that weight, you're looking good, the blood pressure is coming down, you don't have any medical problem, stay at 135. That's just me personally saying that. But again, get with your doctor. Dr. Coy?
No, I think you hit that.
All right. One thing I like to share, as some of you all know, we, WTS, we are an actual AHA training site. That's one of the things that we pulled up. And coming into heart health is just bringing up statistics, because a lot of people just give information, but we love to base it on numbers. This is your most recent one, 2024 heart disease and stroke statistics update fact. So we're just going to skip straight into it. Up here, it's just talking about the AHA. And it starts with 21 and so forth, talking about heart disease, stroke, and other cardiovascular disease. And cardiovascular disease, or what they say CVD, listed as the underlying cause of death accounted for. You see that big number of deaths in the United States is 2021. So I think is we have to go see a doctor more often. That's our biggest thing. We have to see that doctor more. What up, Dan H? We have to see that doctor more often. We have to focus on that. Going down to this bullet here, 2021 United States coronary heart disease was the leading cause of death. 40.3% or 40% attributed to the CV cardiovascular disease in the United States, followed by stroke, high blood pressure, heart failure, and diseases of the artery. So again, we're hitting it right now. What we're talking about, we have to see a doctor. Yes, exercise is good. At the same time, go see a doctor. Get that physical. Figure out what we need to do as a game plan. Going on down, I'm not going to bore you with numbers, but going on down, we're talking about coronary heart disease as well. And you see what it is in 2021, how many deaths we had. We're talking about stroke as well, accounting for approximately 1 of every 21 deaths in the U.S. That's scary. That is very scary. One of every 21 deaths. On average, someone died every 3 minutes and 14 seconds. That's crazy. And these are your most recent numbers. And like I said, I'm not going to bore you. We're going on sudden cardiac arrest. That means that the heart just gave out. So they're going to sudden cardiac arrest. In 2021, over 20,000. That's crazy. And then according to the 2022 U.S. data, we talk majority of adult out of hospital cardiac arrest, 72% occurred at home. 72%. So they're saying majority of your cardiac arrests are going to happen at home. Knowing this, I can't stress this enough. You need to be CPR certified. You need to take a class. If you're in the Atlanta area or the Vegas area, you got us. If you're in the Florida area, we have a lot of connections as a training site. We can definitely point you in the right direction if you want that medical trainer. We'll point you in the right direction based on where you're located. I tell people you want to be your family first responder. If they have a heart attack or something of that nature, you can treat them because it takes anywhere from 9 to 8 to 9 minutes to get to that site, or get to that scene. So be mindful of that. Going on down even more, we're just talking about smoking. So we want to quit the smoking. That's weakening the arteries. We talk about exercise, physical inactivity, and this is the U.S. alone. And notice the key word here was aerobic activity. So again, walking. At all things, start walking. Here, among U.S. high school students in 2019, 44% were physically active for 60 minutes or more at least 5 days a week. That's 2019. So now we know that more of our students, as a high school teacher, more of our students are inactive. So we have to get our youth to get a little more active. And they follow what they see. If they see us not being active, they're going to be inactive. Nutrition as well. And these are some other things. I'm not going to go into it. Overweight, obesity. So with that said, these are just some recent numbers, but got to exercise. That's going to be one of our main things. Just got to exercise. Does anyone have any questions before we move on to the next part of the discussion? Oh, Homesteader here. It says, will vitamin D deficiency affect blood pressure? So we didn't talk about that a lot. So knowing about that, vitamin D deficiency, will it affect blood pressure? She just had the labs done on Friday, and my levels are extremely low.
Yeah, vitamin D is a very, very important aspect to the conversation, especially when it comes down to things like diabetes, hypothyroidism, blood pressure, and all these things you can kind of lump these things all together. Like when we say high cholesterol, high hypertension, pre-diabetes, diabetes, overweight, obesity, all of these are what we call metabolic syndromes. And I know with diabetes, with vitamin D deficiency, that can be an independent cause of diabetes by itself. And there are numerous other reasons why a person could be a diabetic. But again, when we look at, diabetes is actually a protective mechanism that your body's not willing to put that glucose that's parked in the bloodstream into the cells to use it. And so there's a reason why the body is holding back that. But what we see is that, numerous issues with nutritional deficiencies, if nutrients are not getting into the cells, not only we just talked about, iron deficiency. We talk about, B vitamins. We need to talk about all these essential vitamins and minerals, not just vitamin D, but all these essential nutrients that the body needs, the cells need it for their proper function. And so when these things are not happening, there's not a transference of resources to where they need to go, there's going to be disruption. And so if we look at hypertension is just a sign of the body being imbalanced. When we look at diabetes or pre-diabetes, these are signs that the body is not balanced. And so you have to look at, okay, well, why is that happening? And so testing is very much important as to why that is going on. So, one of the things that I would say is that speak to your doctors about how to make sure that you get your vitamin D up. You may want to even look at these other nutrients and vitamins and minerals that are deficient, magnesium and all these other nutrients that you need to get tested as well to make sure that you're not just being tunnel vision on one nutrient. You have to look at all of them, the major ones that help you to be healthy.
Okay, so here it says, can you discuss? So these are different types of medications. One is definitely, I got you, Joval. One is definitely talking about your blood pressure medications and almost a beta blocker. I think if y'all lead me in the right direction with that. Dr. Whiteside, can you hit on this for a little bit? Oh, you're on mute. I don't even hear your volume. You may have to log out and come back in. Dr. Hoy, can you hit on that? Because again, you're dealing with medication as well. So can we discuss this real quick just to give a better understanding?
Yeah, so there are numerous, and Dr. Whiteside, because he prescribes medications, I don't. So I'm on more of the holistic natural side, where folks are coming to me, they're saying, hey, this is not working, and I want to get off of these meds. So understanding that that hypertension, and when we look at heart health, that hypertension is going to be caused by inflammation and the blood vessels being damaged and stress and all of these and renal dysfunction, kidney dysfunction. And so if we look at it, the traditional medical model will say, okay, well, this is too high, this is too low. Well, this is a medication to be able to make that deficiency happen, or to rev up something that's low, or to bring something that's down. And so there are numerous medications that allow that to happen. And Dr. Whiteside talked a little bit about this in the beginning of how the kidneys work, and they're responsible for not only providing us to get rid of waste, but also matters with our blood pressure as well.
Dr. Whiteside, can you hear us?
I was trying to figure it out. I can hear you. Can you hear me?
Yes.
Unfortunately.
Whatever, punk. No, sorry. Let me back up. One of the things I was saying was that the vitamin D deficiency is associated with the increased renin-angiotensin syndrome. Basically, it's located in the system, which is dealing with the kidney. So yes, low vitamin D deficiency will increase your chances for high blood pressure. But like Dr. Coy said, it's more of a nutritional issue. You need to find out what other nutritional deficiencies you do have. Sorry, I missed it. I'm trying to see. Can you discuss metoprolol in detail for persons already taking amlodipine? All right, metoprolol, it is trying to remember. I know it's a beta blocker. Trying to remember it's a beta selective. It's beta 1 or beta 2. I believe it is beta selective, but I'll have to look it up to tell you for sure. It's been a while. Metoprolol and amlodipine, good combination. I have no problem with it. Usually for me, the medicine I personally like to use, especially in the African American population, is either amlodipine or nifedipine, or if they want to be on a beta blocker, it's called carvedilol. Carvedilol, I like that particular medication because it has both alpha and beta effects, so it works on two different mechanisms in the body at the same time. But that's just me. But if your doctor puts you on metoprolol, that's fine. And usually the price of metoprolol is generic and it's cheaper than other medications. So that's why more physicians will go with the metoprolol. And your amlodipine, great medication because of what it does. It works with the genetic coding in the African American population and actually helps lower your diastolic number. So I like both of the medicines.
All right, so here Eric say, I don't do medication. I rather do teas, fruits, vegetables, really trying to add to the garden to help my health. So going on the garden aspect of this and going to the holistic. So Dr. Coy, going to the holistic.
Yeah.
What about this part?
About, say that one more time.
I'll put it up for you. I don't do medication. I rather do teas, fruits, and vegetables. So going to the holistic part, I'm really trying to add to the gardening to help my health.
Got it. So again, for me, one thing I will always mention is again, make sure that you look at all of your risk factors in regard to your health. I think there's a time and place for medication for certain reasons. Again, like if my blood pressure is 200 over 100, I'm having headaches, chest pain, I'm having blurry vision, I'm on the verge of passing out, get me to the nearest hospital and pump me up with much medication as possible so that I can get myself down to a normal state. And thank goodness we have emergency, personnel and our EMTs and, our ER. That is our really how the medical system is built, is based on emergencies, right? And so to save people's lives, and that's important. So I value what you guys are doing is everyone can be a healthcare professional, and looking at those statistics very troubling and startling that, you know, people can have a stroke, you know, at a moment's notice. One of the other things that I've done in my practice is I will test our CDL licensed drivers, our truck drivers that are on the road. And a lot of times they are, unfortunately, some of the most unhealthiest individuals that are out there. I respect what they do, but sedentary lifestyle, being in that environment, you know, the food is not always the best food on the road. You know, there's a whole lot of factors and stresses that that person is going to have. And so when we have those issues, folks have a prevalence of having heart attacks and strokes. So we have to make sure that we put that on the forefront. But, you know, a lot of times when people come to me, is that, hey, they've done this. You know, when you have a medication, we talked about this last time, is anytime you have a medication, there's going to be some type of side effect that comes along with it. And so each individual has to take their own risk. It's a risk and reward that goes along with, just for the sake of getting that number. You have to really look at, okay, well, how is this really affecting you? And so if you're looking at trying to get away from meds, yes, you need to change your lifestyle. Find out what stresses that are there that are pushing your blood pressure up, and finding ways of lessening that pressure, and lessening that stress that's on the body, whether it's chemical, physical, or mental, emotional. So that's what we'll look at as a practice.
Right here it says, we've always heard them talking about A1C, lower your A1C, going back to when we talk about the thyroid and talking about the different medications, Ozempic and all that, lower your A1C. What exactly is A1C, and how does that play a role in just cardiac issues, high blood pressure issues, just in general? What exactly, because we hear the term, well, what exactly does A1C mean, and what does it do?
Yeah. So with A1C, if you look at it, is really determining how much, it's a determining factor for diabetes. So again, if you think about, again, heart health, you know, a circulatory system is there to be able to deliver. It's the highway delivering all of our resources, delivering our oxygen, delivering nutrients, getting rid of waste, allowing us to live. It's the lifeblood of our being. And so, you know, when we talk about nutrients, we're talking about how we can get all the cells to get the energy that we need. And so we eat food, we digest it, mash it with oxygen, and is absorbed in our circulatory system to get delivered to all the cells of the body. And when we look at that glucose, the glucose is basically like the body's gasoline, to be able to provide the energy for it to be combusted and used for the energy that we require. And so A1C is going to determine how much glucose is actually in the bloodstream at that, not only at that particular time, but even up to 3 months prior, because it's basically carried on that red blood cell. That red blood cell has like a 90-day lifespan. And so it's going to look at that. And if that A1C is high, with their numerous numbers out there. So pre-diabetic is anything between 5.7 and a 6.4. That's pre-diabetes. That's, again, so a lot of people say it's borderline, and I don't really get into that. I just know that means that you're not able to normalize your blood sugar. No, blood sugar is just parking in your bloodstream. What does that do? It's the blood glucose is the glucose in the bloodstream is very toxic to the system. It's not supposed to be there. So it needs to get from one place and get to the other as quickly as possible. So if it's just parked there, it's going to cause damage. It's going to cause issues like hypertension. And then when you see your A1C being a 6.5 and up, That is called diabetes. That means that you're still not controlling your blood sugar very well. You're still not able to control your insulin levels very well. It's going to cause numerous issues with your bloodstream. Is going to cause issues with inflammation, and then that also causes this issue with, in some folks, it can be weight gain. For some people, it can be prevalence of heart attack and stroke. It could be issues with renal failure. It could be issues with all kinds of other inflammation in joints. So all these things come about when you're talking about A1C, and it's important not only you check your A1C, but you also need to look at these other factors. One other factor that's often missed is a marker called CRP. That's C-reactive protein. C-reactive protein is one of the hallmark markers for hypertension, but also your risk of having a heart attack or stroke. And so if you're concerned about your risk of heart attack and stroke, some people say, well, I have I have a hereditary predisposition, with heart attack and stroke, and I've seen this in my family over and over again, but they haven't really understood their own risk. I recommend that you have your doctor run a lab or a marker called high sensitivity CRP. CRP. Just remember that. It's going to show you that your risk of having a heart attack or a stroke, and it shouldn't be more than 1. And so if it's more than 1, you basically are running the risk of having those things. I had a gentleman today, his was a 37. It was astronomical. Like,
hold on, back up. I'm slow. What was the 37?
His CRP, his inflammatory marker.
Oh,
Yeah.
my bad. I'm thinking A1C. I'm like, what?
No.
I'm looking at these numbers. I'm like, that's not it.
So here's the thing. Again, these are things that you need to be looking at. Like CRP is a marker that is associated with hypertension, is associated with inflammation. But again, when we talk about those statistics that you just showed, how this relates is a lot of times doctors won't even run certain labs to even tell you how much of a risk you're at. And that's where some people will minimize and marginalize their risk, because sometimes they don't even feel it. They just keep going. I'm not in the hospital. I'm still able to work. I'm still able to handle, my job, my kids, and all these things. And all these things go about, and the next thing you know, boom,
Yep.
You're out. And we see this. That's that silent killer. So C-reactive protein is a marker that you need to run on yourself amongst these other markers to understand that this is an inflammatory issue, and inflammation is a part of you. You need it, but you don't need a whole lot of it. And if it's a whole lot going on and you're not able to adapt to that inflammation, when you don't adapt, you die, literally.
Yeah.
All right, so if you take a look at this diagram, so everybody's in the chat, if you take a look at this diagram, if you notice up here, you have your normal coronary artery, and notice how it's actually clean. Now, we know as we age, it tends to clog up slightly, or something like, tell people, think of it as a drain in your sink, how it's slowly draining. So based on what we eat, it's going to slowly clog up. And if you go to the right of that, notice what's going on. He's talking about a CRP, and he broke down what CRP is. Notice that you're starting to have a little bit of clogging that is going on with a soft buildup. Notice, and going down to another one for the increase. So he used that keyword inflammatory inflammation, early inflammation. So notice what's going on in CRP molecules in the blood, and then advanced inflammation, or then inflammatory, increased plaque. So as you increase plaque, you have a higher level of CRP. You have severe inflammation, and notice what's going on. This is the clogging of the arteries, and that's what he's referring to when he say you die. There's no blood getting through. So you're going to have these signs, you're going to have these symptoms, you're going to, and I won't say you, but people tend to ignore these. It's like your body's giving you a warning sign.
That's right.
Or I got a headache, or somebody was saying earlier, my vision is starting to get blurry. That's a warning sign. That's not normal. So let's figure out what's going on. Go to the doctor. If that's clogging of the arteries going on, we need to unclog those arteries. There's things that they can do to unclog those arteries. So our body's giving us warning signs. When you get these blood tests done, y'all can talk about the medical aspect. I don't know how it is with billing, if they cover this type of blood test or not. On the phlebotomy side, when we draw blood, we'll draw it, but we don't know if it's covered on y'all side. But these are the things that you need to be tested on just to make sure. The older we get, the more I hate to say it, the older we get, the more tests we have to run.
Yeah, I run these tests on me at least once a quarter, just to make sure that I'm good. And I would say that, there's times where, hey, things are not so good, and I have to, get on my discipline and handle what I need to handle. But it's not going to be a lack of me not knowing, right? I'm not going to go down like that. And considering that we all have different types of stresses that's going on. Again, stress comes in different forms. Physical, again, we have injuries, old injuries. We have all kinds of physical ailments and things of that nature that cause inflammation. That's going to impact your circulatory system, your heart. It's going to impact your heart health. Again, stress. When we have mental, emotional stresses, you can just name it. There's a whole lot of stuff going on. You got to really understand what are drivers of cortisol and hormones and all of those things. Those impact your blood pressure. And obviously with chemical stresses, toxins, our food that we eat, the places that we work, the exposure that we have going on, all those things come about with that.
Okay, so it says here, Joe was talking about what about, because he was asking about the A1C. We broke down the A1C, excellent job on that. And you actually hit on CRP, which I didn't even think about. So excellent job on that. So what about the oxygen levels in your blood? Because I know one of you all touched about that earlier, dealing with the hemoglobin and the lower iron and the lower hemoglobin, things of that nature, or in the SpO2. So what about the oxygen level, or in this case, we're talking about the SpO2 for this one?
Well, for people should know, nobody breathes at 100% oxygen. That's the first thing. So that's one thing people need to know. Normal oxygen level runs between 94 to up to 99. So as long as you're within that range, there's nothing truly to be concerning about. Me personally, I like to see somebody closer to that 97 to 98 range, even 99. When they're under that, then it's letting me know that is there any issues that's going on. But I guess my question is, what is it that they're looking for from the SpO2? Because as long as you're oxygenating, you're fine. But I guess I'm trying to figure out what's the question about it.
What's a general level? I mean, you already hit that part for the SpO2. If you put on the pulse ox, about 98%. Some people think we just breathe 100%, which is not really the case. The older we get and whatever our lungs are exposed to, that's number's going to actually decrease. So typical, What's the typical range for the pulse ox?
Yeah, that's it. 94 to 99. That's generally good. Okay.
And then with clogging of the arteries or something like that, is there an indication would our pulse ox actually be lower or no?
No. Well, your pulse ox tend to stay about the same. The problem is that you'll actually start becoming symptomatic, because when you start having clogging of the arteries, I like to do the way Corey does, is related to traffic jams. So you have your blood cells. Your blood cells are going through the vessels just like cars are going down the highway. Once you have a traffic jam on the highway, there's a backup. So when your blood cells are hitting plaque, there's a backup in there. That's when you start feeling the symptoms of the headache, the chest pain, the shortness of breath, the dizziness, because there's a lack of blood flow, there's a lack of oxygenation going to the rest of the body.
So here, Eric is talking about, because I have emotional stress, and that's one of the things we're talking about, stress management, because I have emotional stress. I haven't been sleeping well, and we know textbook definition is 9 hours. In the real world, we ain't going to give them 9 hours of sleep, but 7 to 8 is nice, if that. She says she get about 3 hours a night. She's overthinking.
That's horrible.
That's horrible.
Break it down.
That's horrible.
Let's talk about it.
And the reason being is because that little bit of sleep, one, your body's staying under stress, so you're going to have increased cortisol production. Once you have increased cortisol production, your body's automatically saying, I'm under stress. When you're under stress, then you have inflammation. When you have inflammation, the body starts breaking down. So stress is a negative impact on the body. Yes, emotional stress can cause damage. It does end up having physiological changes. It causes physiological changes to the body.
Yeah.
And so I like to tell people, well, if you have the emotional stress, I can throw medicine at you all day, but my thing is, let's determine what is the underlying cause.
Right.
As a provider, I need to know, well, what is it that I can do for them? If it's a medication, great. But usually a medication is not an end all be all. It's usually we're figuring out what's really going on in their life and how can we help adjust their lifestyle to be more appropriate for a healthy living.
Right.
Typical bodies, how much a body needs sleep, it actually varies among people. There are some people whose body only needs about 5 hours of sleep, between 5 and 6, which is okay. There are some people who needs that 7 to 8. There are some people that requires more. It's really based on your body. No one person is ever the same. That's the catch. For me, I'm usually getting about 5-6 hours of sleep, but it's best. But you want to know, is your sleep where you getting into that REM, that deep sleep? That deep sleep is where it allows your body to relax and all the healing process to occur and decreasing inflammation.
Yeah,
What you got, Dr. Cole?
Yeah. So you're mentioning about cortisol, and so just think about it. You know, cortisol, that's your flight or fright response, right? So if you're always under lots of stress, and your physical, not only physical, not only chemical, but these mental, emotional stresses, that is going to cause cortisol to go up. That's your flight or fright hormone. And that's also going to kick off another hormone called epinephrine. And that is going to actually constrict your blood vessels. So, you know, that's a thing that's going to happen there. So, you know, if we are constricting blood vessels, what's going to happen with your blood pressure? It's going to go up. So these are factors that you have to, you know, understand, that stress, and let me just say this, it's not the stress, it's actually your response to the stress.
Yeah.
So gravity is a stress, right? You know, so it's how we respond to it. If you're not responding well to stresses of life, you know, people that have a poor stress response, again, you're not adapting very well. You're not resilient. And that's where the body just continues to break down. And so how do we become resilient? Well, you got to make sure that you have a path of healing. Where do you heal? You heal when you're resting, when you're sleeping, and not only just laying down in bed, but like Dr. Whiteside said, is to get into that deep sleep. How long you're in that sleep, you know? So I'll have patients, you know, have a wearable device to at least get it gauge on how they're sleeping. They'll have a Fitbit or they'll have their Apple Watch or something like that, just to get an idea of what their sleep patterns are. And if you're not having proper sleep patterns, it's going to throw off your blood sugar. It's going to throw off your energy, and it's definitely going to throw off brain function, and it's definitely going to throw off blood pressure. So what if you have sleep apnea? You know, that's a big issue, because when you have issues of not being able to get the oxygen and poor sleep patterns, you know, you're going to have issues with cortisol levels jumping all over the place, right? It's like your body is it's going to wake you up because of oxygen deprivation. So these are things that, you know, again, for me as a functional medicine practitioner, I'm always trying to figure out lifestyle. I'm always trying to figure out, well, what can we do to make this imperfect situation better, and work with it as best as possible to help reverse a lot of these things that have occurred. So, yeah.
Now I want to say, and Erica, don't feel like we're jumping on you. We're definitely not. What I would like for you to do is actually find relaxation techniques. And to be honest, speaking to a counselor, or speaking to a trusted person, finding ways to alleviate the emotional stress that you're suffering, removing yourself from that situation. That's what I would like for you to do, because the longer your body is under that stress, that fight or flight, or that adrenergic response, the more your body's going to start breaking down, and it's going to take a negative toll on you, cause a negative impact on you. So yeah, the first thing I want you to do is just be able to talk to somebody and find a way to remove yourself from the situation. That to me would be first and foremost. The amount of sleep you get, you're not going to be able to sleep because your mind is going to always be running. So the only way to get your mind to stop running or to relax is basically removing yourself from that stressful situation the best way you can. I'm not going to ask what it is, but the best way you can to remove yourself from that stressful situation, to allow your body to then slow down and relax, that will then allow you to sleep.
Yeah, there are multiple factors that I recommend. One of them is actually free, and everybody can do it. Is meditation. Some folks will say prayer, but meditation. There's a website called meditationminis.com, meditationminis.com, and it's free. So it's a guide. It takes you through a guided meditation, and there are numerous meditation themes that are there. You just sit back, listen, and follow the guided meditation. There are numerous times, durations that it has. I think that's a good tool to help with relaxation, and it's free, right? Another one that that I love is bridging meditation and actually science, and it's called HeartMath. HeartMath is a device that really taps into your parasympathetic nervous system. So we have two nervous systems. One is your parasympathetic nervous system, and the other one is your sympathetic nervous system. When we talk about stress, when we talk about flight or fright, hey, I got this big grizzly bear behind me, I need to run. That's your sympathetic. That's your flight or fright, right? That's what we're trying to calm down when we need to rest, relax, and to digest our food. The parasympathetic nervous system helps us with that relaxation, sleep, healing, all those things. And so the HeartMath device, it actually is a device that taps in, that you can actually see your heart rhythm pertaining to how it responds to stress. And so that device is a wearable device that taps into your phone, and then you can actually see the effects right there on your phone on how it affects your body and how it impacts your ability to adapt to stress. I do this. Is a very, very effective device that you can see in real time how your body is relaxing. And it's trying to train yourself to be in that meditative, relaxed state. Because again, the world is coming at you for so many different angles, depending on your job, depending on the stresses that you have going on. You know, you have to have some type of, you know, it's never going to be balanced 50-50. So your goal is to try to get as much of it as you can, because it affects everything. It affects your ability to heal. It affects your ability to have proper brain function, energy, whatever goals that you have for yourself. So HeartMath, look it up. It's a device that you can purchase. It's a great gift for a spouse or a loved one if they're having issues with stress, or even using it yourself. But also meditation, and meditationminis.com is a valuable website that I use, and is very good.
Yeah, what you got, Eric?
All right. I'm dropping these. As long as y'all know, we're not sponsored by any of these people. So
No,
we're not sponsored by any
Would
of
be
it.
nice, but no.
Erica, I literally just dropped the link in the chat for you. Is heartmath.com, heartmath.com. So you can check that out. One thing I noticed that's going on an hour and 13 minutes. So we want to wrap it up. One thing we're going to do is roll over. How do I say this? We're going to roll over. We're going to roll over because again, it's still in February. We're going to talk about heart month, heart health. We're going to talk about sleep apnea, which is one of the biggest things. So you, your spouse, or somebody may be snoring like a freight train. So we're going to talk about that as well. Let's go back and recap some things just to tie some people in. Hey, Shifire, thank you for joining us. Just to tie some things in, make sure I got the right screen up. All right, so here. So segment 1, understanding heart disease, common heart disease, hypertension, heart attack, stroke. We did hit all of that. Risk factors, genetics, lifestyle, lifestyle and diet. We did talk about that as well. Key heart disease statistics from the American Heart Association, 2004. We talked about that. Segment 2, we talked about, Eric even brought this up, so thank you for that. Fruit, vegetables, whole grain, lean proteins, foods to avoid processed foods, anything high in sodium. We talked about earlier when we talked about the different types of salts. Trans fats, meal planning is one of the biggest things. Meal prepping, I should say, meal prepping, and never go to the store hungry. We talked about
that would be probably a topic. That would be probably a good topic to do later, because that in itself is, I mean, we can talk all day on the nutritional aspect, and I'll love to if we could expand on that one next time.
Cool.
Yeah, we hit that next time in March, 1 to 2. Yeah,
Yeah,
do that.
Cool.
And chat, let us know. Let us know when you want us to hit it. We have no problem doing that. We love the suggestions anyway. Segment 3, exercise and physical activity. The benefits of cardiovascular exercise. We did, I think it was Homesteader. Hope I don't say it right. Homesteader Rachel was talking about that. Exercise. Can we exercise? And what about it? And the biggest thing he said is when you first get out there, start walking, get a physical, make sure you're good to go instead of just going out there and going hard. So physical activity is definitely a good thing. Best exercise, notice that in that second bullet. For heart health, walking, swimming, strength training. Biggest thing is walking, and recommended exercise frequencies. Honestly, if you're starting out 2 to 3 times a week per se, and then you can always do more than that. The one thing people fail at is they go out and say, I'm going to do 5 days a week. Yeah, let's start off slow. Do one day, see how you feel. Don't try to go back the next day if you're sore. You want to stretch it out. Take a day off, go the next day. So every other day, and then slowly build from that. Dr. Corey, you want to add anything? I knew. You good? Oh, you're on mute.
You're on mute, Coy.
Go. Had to find a mute button. Going hard too fast. Just try to slow it down, build up, find somebody that that can assess you, can really go through a physical examination and just make sure everything's checked out, and then build up from there.
Yep. Cool.
Yeah. Let me jump in real quick on that one. When it comes to walking, I like to tell a lot of people, and Coy, I'm pretty sure he'll agree with this. If you want to walk heels. Don't do flats, walk heels. And the reason I say when you walk your heels, it forces you to use more of your body. When you walk on flat ground, then you're just walking, you're just walking through the park. When you hit the heel, you're actually using your core, because your core is your stomach and your back. It's tightened up. It's helping you keep great posture, but you're also using those muscles. Then it forces you to use your glutes, your legs, your quads, your hams, your calves. And then also getting up that hill is forcing you to use your arms. So it's a full body activity. I'm not saying go up a 90 degree incline, but about a 45 or 30 degree. Something when you hit those hills, you will really actually notice that you're using more muscle, you're burning more calories, and you're actually going to lose weight a little quicker too. That's kind of a hidden trick nobody ever thinks about.
Yeah, for me, I always look at, I'm a biofeedback type person. So, using heart rate monitors, and starting low impact and letting your heart tell you, let that be your coach and let that be your guide. And so we can always take percentages off of your maximum heart rate and start out at a certain place. So depending on if it's walking, then depending on if it's in the pool, depending on is whatever mode of exercise, that if you're healthy and clear enough, you're clear to do the exercise first. Again, I go back to, hey, talk to your doctor. We got that scrolling thing going across thing right there. See your doctor. So if you're cleared, then, hey, get with a trainer, a really good person that is going to be there with you, to help structure something. Don't be that guy or gal that thinks that you can just go back to the high school days and start doing the same old workout that you did, that you put on the shelf for 40 years. Like you may have to, humble yourself and take time, because again, when we're talking about heart health and all these things, you got the high blood pressure and all these things and risk factors. don't fall victim to the exercise actually causing more stress than harm. I mean, it's just than getting the benefit. Let me say that. So,
True. Derek, did you want to add anything?
No, we good.
Okay. Segment 4, stress management and mental health. How stress affects heart health. Techniques to manage stress. Meditation, which y'all talked about, and I dropped a link in there also, meditationminis.com. Breathing exercise, quality of sleep. So we talked about that, the quality of sleep and that mind-heart connection. Yes, at night we got to slow it down. So that's one of the biggest things. Warning signs, segment 5, warning signs in prevention. Early symptoms of heart disease, that CRP, what we talked about earlier, recognizing signs of a heart attack. Your body gives you a warning. One thing in particular here. What about shoveling snow if you have severe heart disease? Your body's going to give you a warning because that's a big stress. And one thing people don't understand is that's total body as well. And you don't know how heavy that snow is. And that's the thing about it. So when it comes to something like this, because it is exercise, and I can tell you now, I have buddies up north. They're always getting 911 calls because somebody had a heart attack from shoveling snow. They get out there and they just shovel snow. They haven't exercised, let's say, 2 to 3, 4 years, only exercise when they shoveling snow, and it just caught up to them. They've been getting those warning signs so often that you ignore it, and then you go out there and shovel that snow. You had that massive heart attack. So when it comes to something like this, you want to be careful, especially if you have severe heart disease. You definitely want to be careful about that and being mindful of that. And if you're the only one out there, take breaks. Shovel a little bit of snow, take a break, take a break. But at the same time, have your cell phone out there with you, or call your neighbor and say, hey, I'm going out to shovel snow. Can you just keep an eye on me just in case? And that's one of the biggest things to do. Or if you got neighbors that have kids, have them shovel the snow for you. Kick them a little $5, $10, something like that. Have them shovel the snow for you. So you definitely want to be careful of that. And like I say, excellent question when it comes to that. Excellent question. When to see a doctor. So you have those warning signs. You need to make sure you actually see a doctor. Encouragement to take heart health seriously. That's what we're here for. We're stressing this. Please take heart health seriously. Yes, it's in February, but this is something that occurs 24/7, 365 every day. So you only have one heart. The heart goes bad and you can't get a replacement, you're done. You're not 6 feet above, you're 6 feet below. So it's something you should take serious when it comes to that. And for here, ignore the future live streams or resources. So we're not worried about that part. But this is some of the stuff that we actually hit today. So this I outline. We like to keep it within an hour. Granted, we apologize for going an hour and 22 minutes, but it was a lot of good information, a lot of excellent questions. Is there anything y'all want to add just to close it up?
Well, for me, I love this topic because it bridges over into so many things that I do in my practice and things that I evaluate for individuals that are looking to, to get to the root cause of their issues. High blood pressure, heart health is very much important, especially when it comes down to metabolic syndrome, obesity, diabetes, all these issues that go into poor health and actually get into the root cause of it. And so, I'm Dr. Coy Ibrahim, co-owner of Coy Wellness Solutions. I'm a functional medicine practitioner, also specializing in clinical nutrition, and obviously with my practice is more holistic. So I'm trying to find folks that are really serious about their health and want to get to the root cause of it. And of course, we have, Dr. Whiteside. He has that traditional medical model background, and we need folks like you guys out there. And obviously, your EMT background, Eric, it's always good to have those things. But the lifestyle is so important. Finding ways to make sure that you're managing a lifestyle, making sure that you're doing whatever you can to not just be totally dependent upon meds and just thinking that you're good when you're not. So getting a thorough check. So for me, if you're interested in getting to talk about your health, feel free to reach out to us, Coy Wellness Solutions. Our phone number is 954-637-2990. You're looking to get checked. You know, you've gotten checked before, but things haven't still not on the up and up. You know, I'll be more than happy to discuss that with you. One of my staff members can also speak to you about that. And so we have free consultations to discover if you're a good clinical and personal fit for us to move you forward.
On my end, Eric Whiteside, shameless plug. I'm about to put up right here. Hey, there we go. So CPR, heart health. If you are not certified in CPR, if you do not know CPR and you want to learn CPR, we have classes available for you if in the Metro Atlanta area. If you are not in them, I know it sounds like a salesperson now. If you're not in the Metro Atlanta area, we are a training site for American Heart Association. So we do have CPR instructors across the U.S.
Cool.
So if you send us a message, say, hey, I'm located in this state, do you have instructors in this area? We'll find them for you. We got you. If there's something you want to learn, we will definitely take care of you when it comes to that part. We want everybody to be CPR certified, first aid CPR certified. So definitely hit us up. You can hit us on Instagram at Whiteside Tactical, at Whiteside_tactical, or hit us our email info@whitesidetacticalsolutions.com, or hit us up on our website www.whitesidetacticalsolutions.com. Ask the questions. We'll answer them. As you can see, I know we're not the typical. I have an educational background, so I tend to teach a lot and show a lot of visual, but as we get older, we're more visual learners, and it brings more meaning to this. So yes, let us know. Questions, just holler at us. Please do. Dr. Whiteside?
No, I don't have anything. No, I appreciate y'all. I appreciate everybody that's joining in on the live. I'm sorry for some of the technical issues we've been having, but
no, you were having, not us.
Hey, I'm trying to blame it. We a team. We all been.
No. First of all, you're talking about my beard. You're talking about my age. I think that's disrespectful. Especially,
hey, I'm talking about it in your face, though. That's the thing.
Not behind you back in your face. Oh,
my wife likes it. My wife likes it. That's all that matters.
That's all that matters, right? That's all that matters. All right, we're not going to hold up anymore. We're going to out.
Thank you, everybody.
Why are you so funny? All right, we're going to hour and 26 minutes. Is there any questions from the chat that y'all may have? Like say next time we're going to hit sleep apnea and looking into, I think you said meal prep or nutrition. We're definitely going to hit that up.
Yeah,
we're going to try to bring some nutritionists as well as some other doctors on board as well. One in particular we're going to try to bring on is a GYN. Ooh. So from a female aspect of that, again, we want to make sure everybody's taken care of, not just focusing on one person, but want to make sure everybody's taken care of. Oh, your mama like us? Oh, see, somebody like us.
No, like us, not you, Eric.
Oh, hey. If you don't like me, you're thinking about me, so it don't matter. All right, with that said, it's an hour and 27 minutes. You all have a good one, and we'll check you next time.